My name is Benjamin Levy, and I'm a gastroenterologist at the University of Chicago. As a music major and pre-medical student at the University of Virginia, I started organizing concerts. Afterwards, I completed a Fulbright fellowship in Paris with the Orchestre de Paris and the Paris Opera. Over the past 15 years, I've been lucky to combine my passions for music and medicine in order to teach others about public health. During medical school at Emory, I organized Music Inspires Health, a rock and hip hop concert tour around the country featuring musicians such as Ingrid Michaelson, Trey Songz, and Ben Queller. I got the idea during medical school because of the pioneering work of a rock band named Queen, who in 1992 organized the Freddie Mercury tribute concert because their lead singer, Freddie Mercury, had just passed away of AIDS in 1991. It featured the biggest rock stars of the day. U2, Guns N' Roses, Elton John were among the acts that helped Queen teach the world about HIV prevention. It was a worldwide broadcasted concert to 76 countries around the world and reached 1 billion people. Through their efforts, they were able to decrease the stigma around HIV and to teach people about consistent condom usage. It made a huge impact on public health and inspired me to continue their work with health education projects. Now, during medical school, I organized a 40-member National Medical Advisory Board that helped me, including 3 previous CDC directors of HIV, STD prevention, and the director of public health from Los Angeles County, as well as several medical school deans, including at the University of Virginia and GW School of Medicine. We had a business advisory board that helped us put together a marketing strategy, and I learned many important lessons, which I'll help you with today. Now, around that same time period, Katie Couric was working on another campaign called Stand Up to Cancer. That was formed in 2008, and a song was written and released and recorded by a number of really important artists, including Beyonce, Carrie Underwood, Sheryl Crow, Miley Cyrus, Fergie, and Mary J. Blige, just to mention a few that helped. And they were trying to encourage people to gain knowledge about cancer, cancer prevention, and to raise funds for cancer research. It was a really important campaign. Now, fast forward to the pandemic. I got the idea after working with several friends at the Chicago Symphony. At the time, I was co-chair of the Chicago Symphony Soundpost series. And we came up with the idea of teaming up musicians with physicians and nurses on the front lines in order to teach the public about physically distancing and wearing masks consistently and properly. This was during the first lockdown in April of 2020. And we got the idea to broadcast via Facebook a health education concert that was 90% entertainment, but we had physicians and nurses nationally help us record PSAs that we broadcasted every Saturday night. That campaign was called Concerts and Cocktails. From that, I was asked to develop a TEDx talk for TEDx Wrigleyville on how to organize health education campaigns using music and concerts. Now, the president of the American College of Gastroenterology saw my TEDx talk and asked me the next week if I'd be interested in helping to team up with the American College of Gastroenterology to organize a concert for Colon Cancer Awareness Month in order to encourage the public to get screening colonoscopies. Also, we wanted to teach the public about the new colonoscopy guidelines. Now, the American Cancer Society had just recently changed the guidelines in 2008 to begin screening patients between the ages of 45 and 50 because of an increase in colon cancers that were detected at age 49. And since then, all 3 major GI societies have adapted these guidelines, and now the official age to start screening colonoscopies is 45. So we developed Tune It Up, a concert to raise colorectal cancer awareness. And we organized this also with the help of Katie Couric, who recorded a really cool PSA for us. And Over the past 2 years, we've organized concerts in March for Colon Cancer Awareness Month that have included musicians such as Ben Folds, Rufus Wainwright, Lisa Loeb, Tim Reynolds, violinist Hilary Hahn, the Chicago Symphony, the Cincinnati Pops, among many others. And this has been a truly successful campaign. Also in 2021, the Stand Up to Cancer campaign developed additional programming, including a new concert that was broadcast worldwide featuring both Stevie Wonder and Common. And they also worked to develop a colorectal cancer screening campaign with the help of hip hop artist Chuck D. Selena Gomez has also developed a health education campaign, Your Words Matters, which is a campaign she started in 2022 around mental health. Now, I'd like to teach you some lessons about how to build a successful health education campaign. Number one, do your formative research. This is incredibly important. For all of my projects, I've had both focus groups and surveys in the format of online surveys and paper surveys in order to learn from our target audience what health topics they wanted to learn about and in what way. And we also tested our PSAs with focus groups. This is incredibly important. Also, it's important to build a really great team. That would include public health experts who specialize in health communications, outcomes researchers, in addition to that, medical experts who can help develop the PSAs with accurate health information, as well as help from marketers who can help you with social media strategy and branding experts. Now, for the Music Inspires Health Project, I put together a 45-member National Medical Advisory Board that was critical to developing our health education messages that would be empowering. In addition to that, I've always used the help of social media in order to get our words out. It would be naive to think that a one-off event would change people's behavior. So you have to hit people in several different ways over a long period of time. So we develop poster campaigns for each of our projects, social media campaigns, including use of Facebook, Instagram, TikTok. It's really important to get the health information out there via both social media and via live stream events. Now, there's also been some research into using music in order to actually impact health outcomes. Now, many people use music as a coping mechanism to help with stress in their life, and I encourage everyone in the public to do that. It's great to come home at the end of a tough day, or if something's going on in your life with your family or your health, and listen to music, and that will help you decompress. The American College of Cardiology has actually done a study that shows that with heart failure patients, listening to music decreases heart rate and oxygen demand on the heart, as well as respiratory rate, and can actually prevent a future heart attack. Pretty amazing. Now, for years, musicians have used music as a way to deal with depression and to start a conversation internationally about this. Several of my favorite examples include The Fray, which recorded a song, How to Save a Life. Pink Floyd, Shine On You Crazy Diamond, talks about mental health, illness, and drug abuse. Pearl Jam recorded a song named Jeremy about depression and bullying. And REM recorded a song called Everybody Hurts, which talks about depression. And these songs have decreased the stigma associated with both depression and anxiety, and I really think has made a major impact on how we think about mental health today. Now, music can be used as a powerful platform to teach the public about health in a fun, non-judgmental way. Over the past 15 years, public health experts have increasingly used music and concerts to reach large audiences and to improve health on a large scale. As the American public struggles with the obesity pandemic, we encourage physicians and public health experts to teach about exercise, nutrition, and diabetes prevention with music health education campaigns, something that will really resonate with our target audience of adolescents and young adults. We also hope to improve smoking cessation, breast cancer screening, and colonoscopy screening rates through the use of music. As a gastroenterologist, my colleagues and I are working hard to teach the public about the new colonoscopy screening age of 45 because of new data that showed a jump in colon cancer rates at age 49. Now, if we start screening colonoscopies at age 45, we can remove polyps before they can turn into cancer. Organizing nationally live-streamed concerts for Colorectal Cancer Awareness Month in March featuring rock, hip-hop, jazz, country, and classical musicians has allowed us to reach both mainstream and vulnerable patient populations. Our goal is to encourage the public to get screened with a colonoscopy so that our patients live healthy and long lives. Thank you.